Hi, good afternoon, Miami Gardens. Welcome to another episode of Live Healthy Miami Gardens Live. My name is Melissa P. Dunn. I am the CEO of MD Marketing Network. I'm also a member of the Live Healthy Miami Gardens Communication Subcouncil. Um, I see that we may be experiencing some technical difficulties. I'm not really sure why, but hopefully you are seeing me. If you're watching me on the chat, just go ahead and put a yes in the chat as we wait for people to come in. And I'll ask my technical producer to please just go to Facebook and take a look to make sure that the stream is coming in properly. As I get ready to introduce our guest. So today's conversation is a little bit different. As you know, once a month, we have a conversation around COVID related topics. And today we are going to be talking about sickle cell anemia and COVID 19. Today, this month, actually, September, is Sickle Cell Awareness Month. And I am going to bring in my guest, who is a nonprofit organization advocate for those who are suffering from sickle cell. And she amplifies the message, the need for us to be tested, the need for us to really spread the word about sickle cell anemia. Hi, Andrea. Welcome to today's show.
Hi, Melissa. Thank you so much for having me.
So happy to be here.
Yes.
Is it, can we just double check? Can I get a note from our technical producer? Is the show showing well on Facebook? All right. Okay. So while we try to, um, you know what? Let's just have the conversation because it looks like we're streaming very well on YouTube. So we'll figure it out after the fact. Welcome to the show, Andrea.
Hi, thanks for having me.
Okay, so tell me
Right.
about Shaq's Hope.
So, Shack's Hope is actually the brainchild of my daughter Shakira. She started Shack's Hope in January of 2016. And the whole idea of Shack's Hope was our mission is to bring awareness and educate while we improve the quality of life of those living with sickle cell here in South Florida and in Jamaica. Unfortunately, August of the same year in 2016, she lost her battle from complications due to sickle cell. So we are here. I'm continuing her legacy to bring awareness to those and advocating for them.
Wow, I'm so sorry to hear. And of course, I'm familiar with you, and I'm familiar with your daughter. It is never easy when you lose a child. How long did she battle with sickle cell?
I found out that I had the trait when I was pregnant, and that's the first time I knew. Then her dad had to be tested. I went to did genetic counseling so that I would understand all there would be to know. They
Mm-hmm.
told me it would have been a 25% chance that I would be born with a child.
Mm-hmm.
With the disease, a 50% the trait and a 25% chance none, because I have a normal cell and an abnormal cell. So did her dad. By the time she was born, within 2 weeks, I knew she had a sickle cell trait. They did a blood test at birth,
Mm-hmm.
sickle cell disease, sorry. And they told me she wouldn't have a crisis until she was about 9 months. But by the time she was about 4 months, she woke up in the middle of the night just with her hands swollen and her feet
Oh,
and
wow.
crying. And that was, I must have lost 20 pounds. That was
Mm-hmm.
when it started to happen. And I would say, there are different types of sickle cell. She had sickle cell SS, hemoglobin SS, which seems to be the most common and the most severe. And I would say she was hospitalized maybe like 5 times a year at that point. So even by the time she was 3, she had her a first blood transfusion. So it is rough. It is
Mm.
it's a deadly painful, and it's they say it's like having a toothache all over your body.
Oh,
It's
wow.
pretty
My
bad.
gosh.
Yeah.
Listen, that imagery, I mean,
Yeah.
everybody can relate with a toothache because we've all had it at some point. And that is painful.
Yeah. It's
And
awful.
and so she had her first crisis at 4 months.
Yeah. Well, basically, and the only thing that they can do is to give them like IV fluids.
Hmm.
Because, of course, if the cells are not round and since they have that irregular shape, they can't pass through the body and the capillaries freely, so they stick. And so wherever they
Mm-hmm.
stick, they create pain. And as a result of the pain, then comes organ damage. So this sometimes their blood work doesn't show, but the damage is still severe. So sometimes it loses oxygen, and then they need blood transfusions. It is it's just it's complicated. And yes, her first one, 4 months, IV. Just imagine a little baby with an IV, at that age, and pretty much that's all they can do is give fluids, which helps to loosen up the stickiness,
Hmm.
and then they give them pain management medication.
Wow.
That's it.
And
Yeah.
so she battled with the disease all the way to adulthood. She was in her late 20s.
She was 30
She
when
was 30.
she lost her battle. I mean, I used to, because I was knowledgeable and I made sure that I joined an organization when I moved to Florida and I educated myself as much as I could. I went to the schools, I spoke to the teachers every semester, gave them information to read, explained to them that, she needs to be treated like someone that's normal. However, she needs extra breaks for water. She needs to go to the bathroom more frequently. I took the time just to do it, but it's let me tell you, the ignorance is overwhelming. There's still so much to do because I remember a teacher calling me when she was admitted and she was actually in the hospital for about 2 or 3 weeks. And she said, "Oh, she only gets sick when she comes to history."
Stop.
Yes. And she also said, just tell her to read chapters 1 through 4 and then, she can catch up. Meanwhile, she's in the dark, in a ball, in pain. Because remember, the pain medicine barely touches the surface. Sometimes it takes days to
Mm.
for them to feel. They just get used to it and they try to find ways to distract themselves. But it hardly touches the surface, and everybody is different. Everybody's
Mhm.
pain level is different. When a sickle cell warrior, which is what we call them, tells you they're in pain, believe them.
Mm.
Believe
And I
them.
imagine now in this space where everybody is super hyper vigilant about opioid addiction, that I would imagine that sometimes if you go to a ER that they don't know your history, that might be an issue, right?
It is a major issue. Actually, if they know you more, they think it's even a bigger issue. So,
Really?
yeah, she would go in the ER, and I was always with her. I hardly ever missed an admission. So, where else would
Hmm.
I be, right?
Right.
So, we would go in there, and she would nudge me because the nurse would be like this, kind of like eyeballing her, like, why you here? You're pretty much here for the drugs, is what they think they're drug seeking. And I think healthcare workers, not all, but I think some of them are not trained in pain management. So as a result of, they just say what comes to mind, and it's awful.
Mm.
I mean, she used to say, I wonder if she realizes I'd rather be at Carnival, or like, I don't want to be here, just like you don't want me to be here. I
You,
don't want to be here either.
I'm telling
And
you.
so I used to give her thank you cards and just say to her, for everybody that cares for you, just thank them. Just explain to them about day 3 when your pain is not so severe, what it's like to walk in your shoes. Because you get more with honey than salt. And
Yes.
you shouldn't have to because your nurse is your advocate.
Mm-hmm.
However, because of the lack of training, I think you just have to do what you have to do. And I found that, just to say, give them a thank you card. Just thank them for taking care of you. And every time she would leave, she would just go back and maybe buy them donuts, or kind of like paying it forward to
Yeah, yeah,
say,
yeah.
if not for you, then the person that comes after you. But, She didn't suffer socially. I would say she
Yeah.
had a very good life. She was very confident and strong. And I think a lot of what I pushed was definitely there, but a lot of them they're mentally down. They're 40% of them have very bad depression, and they get
Mm,
teased. I mean, by other children.
sure, sure,
There are a
sure.
lot of books now on the market. I've bought many of them on Amazon, like My Friend That's a Little Different and Why You Should Show Compassion. And
Mm,
remember, Melissa, compassion is something you're born with.
yes.
It's hard to teach somebody to care. But when
Mm,
sometimes you have that come to Jesus moment and then you realize, this is why I should care.
yeah, yeah,
But it's
yeah.
not really because it affects you directly. It's how it affects all of us and why you should care.
I
You
would
know,
imagine so. And so Shaq's Hope is dedicated to doing what? I hear you talk about advocacy. I hear you talk
Y-
about training and education.
yes. So what we really do is we educate by getting people to know their status. It's very important. When I found out I had sickle cell trait, my mother said, "We don't have that in the family." I said, "Well, I'm not adopted. I look like you, right?" And just to show you how great the ignorance is, so my mother has 9 siblings. She
Mm-hmm.
only has me. I'm the only child from my mother. And I am the only person to date with a child with sickle cell. But just imagine how many of her siblings have children, but they don't know, right?
Mm-hmm.
So my mother passed away, and I didn't get a chance to get her to get tested. I have a half sister that has 3 sons with the trait plus herself. I said, maybe it's my dad. My dad got tested. He doesn't have the trait. So it is my mother because it
Mm-hmm.
is genetic. So it has to
Yes.
be, come from a parent. So, in saying that, you have to, I encourage everybody, know your status. Just get a simple prick to the finger. It's a blood test. It's not an automatic test. You have to ask for it, but everybody should know. If you have a conversation with friends and family, suppose you meet someone and you are at the age where you're having children, at least when you know that, meet that person, you can ask them their status. It's not that you cannot have children, but you should know. You should know what your status is and know what you are in for because you may or may not have a child, but I don't wish what I have gone through on anybody. I don't.
Yeah.
So,
I saw you the other day and I shared with you that
yeah,
I actually found out that I had C beta thalassemia
right.
because, my stepdad was in the military. And so I had to do a physical to go back to college. And I
Right.
happened to go to the military hospital and they tested me for every single thing.
Hmm.
And that's how I learned that I had the trait. And I
Right.
never understood why, like a certain types of year, like if I get really tired, that my body
Hmm.
just aches and I just don't feel right. And it used to be in high school and college, I would have those types of experiences. Um, Not so much now as an adult, right? But
Hmm.
in high school and in college, it was, I had my uncomfortable moments. And then when I got pregnant with my son, I found out that he would have had S thalassemia. No, what is it? A S
If
sickle S
what was your trait was thalassemia, beta thalassemia?
beta thalassemia. Uh huh.
Okay. What about your partner, your husband?
He had the sickle cell trait.
Okay, do you know what kind?
Don't know what kind he
Okay,
had.
so it depends on what he has. So, for instance, my son has sickle cell trait like me and
Mm-hmm.
like his dad because he took one normal and one abnormal. Shakira took the two
Mm-hmm.
abnormals. So in your case, your child would have been, depending on the trait of your husband, it could have been SA like me. So
Mm-hmm.
then he would have had the beta cell S if he
Mm.
took that trait. It depends because they're different ones. There's about four different types.
If I remember correctly from the conversation that I had with my doctor,
Yeah.
I think that it would not have been as severe as sickle cell anemia, but he
Right.
would have experienced some discomfort.
Right.
And he ended up, I mean, he didn't survive. He lived for 31 days, but
Sorry.
um, sometimes when I think about it, and my mom and I talk about it, we're like, God always knows best, right? And you
Yeah.
never, ever, ever wish that, the death of a child on anyone, but perhaps the suffering might have been too much for him to bear.
The thing about it is like with that, I met a girl, she's Greek descent that I worked with that had thalassemia trait. Because remember now, more Mediterranean people worldwide have sickle cell than any other group.
Mm-hmm.
It's only, I think, this side of the world, it's mainly people of color, and that may have to do with slavery, in terms of the Caribbean and the United States. But worldwide, it's definitely Mediterranean. So she has thalassemia trait. She marries a Jamaican, okay? But he's not tested.
Hmm.
So I've said to her over and over, make sure your husband knows his status. Because now you're going to have a child, same situation. If she has thalassemia trait and her husband has sickle cell trait of a different
Yeah.
type, that baby, and he won't get a test. He says, check me for everything. We don't have that in the family.
Hmm.
So it's getting people to say it's whether you experience it in the family, you just never know until somebody has a child and it surfaces. So we all should just know and just get it out the way. A
Yeah.
simple
Yeah.
test.
Yeah.
Just get it out the way and then you can go on to living. I've met families. I mean, I know a family here that has three daughters and all of them have sickle cell.
Oh
And
my
they're in the
gosh. Can you
hospital.
imagine
Yes,
having
they actually have an
all three of
organization
them are
too.
suffering?
Yeah, and I met families in Jamaica. I met a family in April. All three have sickle cell. All three are not the same father either, right? And all
Wow.
of them, and Melissa, two of them are bedridden. Two of them had strokes.
Jesus, Pima.
So if you see me like sometimes asking for wheelchairs or collecting for this or that, some of these kids have had strokes. That's one of the things that happen. All
Hmm.
right, because lack of blood flow and lack of oxygen. Those are
Right,
one of the
right.
things that's very common. Very common. So
How was it with during COVID? Because I know that according to the CDC, folks with sickle cell experience significant crisis if they're also have COVID. What
okay.
were you hearing from some of your clients?
So I here a lot of them just started doing things virtually. A lot of like support groups, we would just communicate virtually to see how we could support. So that helped. But yes, the odds was definitely against them. They were sicker than most because of course they're most susceptible to getting
Mm-hmm.
infection. If it's cold outside, they're sick. You know what I'm saying? Changes in temperatures. If they go to change in climate, the water in the ocean, anything. So they definitely went through it. Um, we remember we do a treat in Jamaica every Easter, and
Mm-hmm.
the first when COVID started, 2020, we there was a lockdown, so we couldn't travel. But we had so many toys that we had collected. So we do like a drop off. We also do a little drive, a toy drive at Christmas at Broward Health here
Mm-hmm.
in Florida. So instead of going in where we normally would go to the outpatient clinic, where we see like about 100 patients, we
Mm-hmm.
had to meet the nurses outside
Mm-hmm.
of Broward Health, like at the lobby, and
Mm-hmm.
everybody was in mass, and we had just boxes on a large metal rolling rack, and we
Mm-hmm.
handed it to them, but we were not able to hand them out, so we just dropped them all off because we still had so many that we had collected, and
Mm-hmm.
they gave it to them for us. So because were stuck with so many, we had so many more left over. I said, what are we going to do? Life still goes on and the patient still needs support.
Mm-hmm.
So we decided in Jamaica that we would do a treat. at a church. So we used the outside grounds. We did like we did distancing, social distancing. We gave out masks and did sanitizing, and it was at Christmas time of
Mm-hmm.
2020, and it actually worked out. We did it. We just did it in smaller groups, no more than 10 at a time, and it worked out. So we were still able to make a difference
Mm-hmm.
and at least just support them in the way that we could. But it was rough. It
I
was
can
definitely rough.
I can imagine. And then did
Yeah.
you any of the folks that you were supporting, did any of them have COVID? And if so, how what was their experience like compared to those who did not have COVID?
Most of the ones that know that had COVID was towards when it wasn't as severe.
Mm-hmm.
Luckily, because a lot of them just went in lockdown mode.
Mm-hmm.
So I think as long as they adhered to the rules, pretty
Mm.
much stayed home. Some of them were afraid to do the shots, so some of them did not,
Right.
and that's a choice. And so they stayed in. And if they went to clinic, they just did social distancing and only saw a small amount of them at a time. Because here at the hospital, they have like a sickle cell outpatient
Mm-hmm.
clinic, and the same in Jamaica as well.
Well, the CDC did actually a study around, well, this on the CDC's website, they talk about a study that happened in Wisconsin at the Medical College of Wisconsin, where they kind of did a registry for patients who had sickle cell disease that also had COVID-19, and the study happened between March 2020 and May 2020.
Yeah.
And they were able to, I guess, register about 178 people in the study. And the average age was about 28. And the majority of the people that showed up that presented with sickle cell and with COVID, they had already had some complications as a relate to sickle cell in the past 3 years, right? Where they've actually already were hospitalized
Right.
already. So I think those who already suffered from sickle cell complications were more at risk
Yes.
for COVID. And 69% of the patients were hospitalized during their COVID-19 illness. And then 11% of them actually were in um, ICU, and 7% died.
Wow.
So out of 178 people in this study, 122 were hospitalized, 19 went to ICU, and of the 19, 13 died.
Wow.
And these are folks that the average age was 28, right? And so I thought that, wow, this is definitely something that we need to talk about.
Yeah.
And I'm just curious, I know for, for a lot of folks that had suffered from any kind of comorbidity or chronic disease, were hyper vigilant during the pandemic about wearing masks and washing hands and social distancing. The folks that you served, were you hearing them being super cautious as
Yes.
well?
Yes, definitely. And even with the trait, which I'm finding out now that there are a lot of things that you can get from having the trait. I mean, I had COVID last year summer, and I've
Mm-hmm.
had like a constant tickle, like a cough.
Oh,
And I've
wow.
gone to doctors. I have high blood pressure. On top of that, I have sickle cell trait. So now I'm finding out that even kidney disease, things like that, we're more prone to. There's certain things, even as
Oh,
the
did
trait.
not know
Yeah,
that.
there are athletes that have passed out on the field from exhaustion, from dehydration, because they've had sickle cell trait, people in the military. So,
Mm,
the trait is not to be ignored either, even though the disease
wow.
is. I have a friend that has a son with sickle cell that lives here. She has four children, and out of one of the set of them are twins, and only
Mhm.
one twin has sickle cell. And she had just received a kidney this year, my friend.
Mhm.
And she kept saying to me before, I don't know where I would have gotten this from. And I was on this Zoom with a doctor talking about this last week. And I called her and I said, it could very well be because you have sickle cell trait. And we just don't even know, even through COVID, some of these things that we're stuck with. Like me, they can't find anything wrong with me, but I'm still coughing.
Wow. You just gave me something to think about
Yeah,
because honestly, until I saw you at the commission meeting this past Thursday,
yeah.
I completely forgot that I had C beta thalassemia because I haven't had any like challenges with it since my early 20s,
Yeah.
because there was a period there, and maybe it's like, and I guess I do, like when my body gets run down, I
Mhm.
prone to get sick, but that's anybody, right?
Yeah.
But you just really gave me something to think about, and I don't think that I have had a conversation about it with my primary care physician.
And you should.
And I should, yeah.
I worked with a girl when I worked for a tour company years ago that found out in her late 40s that she had thalassemia. So she never knew. And can I tell you, the symptoms that she became as sick as Shakira. Like she had a
Wow.
hip replacement. She had a blood transfusion. I mean, by the time she was 54, unfortunately, she passed away. But it wasn't just sickle cell. She also had a heart condition, separate and apart. So that is
Mm-hmm.
what really caused. But when she said to me, I said, you just can't have sickle cell. You can't just know one day. This is something you're born with. However, in understanding more now about the different types, it still varies from person to person. There are
Sure.
people with thalassemia that still get sick, or beta thalassemia that get very
Mm-hmm.
sick. And there's some people that have it milder. I was talking to a pastor that I know in Palm Beach. He has two sons. One is never sick, one is always sick, and they have the same type.
Wow.
So
Wow.
it's
Wow.
one of those things that no two
You never
people,
know. Yeah.
yeah, how things
S-
affect them. Yeah.
So if somebody were to go to your website or give this number that's on the bottom of the screen, the 954-228-0625 number, like what should they call you for? How
Okay.
what specific support do you offer the community?
So our what we really do is when we do events, for instance, we had our brunch on Sunday, which was a great hit with a fashion show. It's our third annual. Quite a bit of patients were there. They seem to love the energy that we have and how we support them.
Mm-hmm.
And I mean, we had warriors that there was a warrior that sang, and also warrior that was a photographer.
Mm-hmm.
So in every way, we were try to include them and support them. They came there just as patrons. They love the fact that it just lifts their spirits, and I
Mm-hmm.
find that that is a very big part of sickle cell is just feeling supported,
Mm.
feeling that people understand
Right.
and that you're there for them, and sometimes just being in the space of what we do.
Mm-hmm.
So again, it's really about providing that feel good, like lifting spirits, making them a part of whatever
Mm-hmm.
it is they do. So, besides getting them to know their status, whenever we do any event, we don't even charge for them to come. They're welcome as guests. We've had domino tournaments, we have a Shaq's MVP program where we go to the hospital and actually visit and
Mm-hmm.
try to spend a little time with them playing like Nintendo Switch, and
Mm-hmm.
just hanging out with them a little bit. The caregivers are very overwhelmed, so any little time that we can share with them, even
Mm-hmm.
for half an hour, is good. And I guess because we have a great link and we collaborate in the community locally with other sickle cell organizations, we
Mm-hmm.
are also a resource for others and what they do. There's a group that we're very, very close with called ASAP in Miami. They have a monthly support group on virtual. So we
Mm-hmm.
can, it's a good source of information. So do you need somebody to speak with? Would you like to get a link for a doctor that's a more holistic approach? That kind of thing. So, like a reference, then we would
Okay.
sort of guide them. Yeah.
Okay. So it sounds like you provide support and referrals.
Yes. Yes.
And then I know that you are also an advocate. You know, you speak to elected officials about and educate them about the
Exactly.
needs for.
And
Okay.
I recently just did a training, medical advocacy training.
Mm-hmm.
It's done by Dr. Simone Ewan. She actually is a medical doctor that lives with sickle cell. She's
Mm-hmm.
in North Florida, and I did it online with her, and it was about 25 of us, and it was amazing. So, if a warrior is at the hospital, for instance, and they've been there for an hour, and they're not getting through, they can contact us. We can make a call to the emergency room on their behalf. It's not that we can speak to things medically, but we could say something like, "Hi, we're calling on behalf of Andrea Hall. She's been at the hospital for an hour. Her pain is a level 2, and under the guidelines of the NIH, she should be treated as such with pain medication. Can you see if you could just go assist her in some way? And just remember that even though we're waiting on her lab work, that there could be damage being done to her body while we speak. Things like that. So just by having a kind conversation with a medical staff or medical facility, sometimes will help them to get through. So that's something I'm very proud of because, again, it'll just help a little bit, just to,
Yeah.
to
Fantastic.
show some
Well,
support.
thank you for all that you do in the community,
You
Andrea. Any
welcome.
final words of wisdom?
Just wanted to tell everyone to please, if just know your status, show compassion, and let's break the stigma. And sickle cell warriors, if you don't advocate for yourself, we cannot advocate for you. And remember, it's not about pity, it's about awareness. That's it. Know your
I
status.
love that. Thank you so much for joining us and
Right.
thank you for everything that you do, Andrea.
Thanks for having me. See you soon.
All right, my pleasure.
All
Thank
right.
you so much for joining us for this episode of Live Healthy Miami Gardens Live. As always, feel free to go to livehealthymiamigardens.com. We are a trusted resource for health information and local resources in the city of Miami Gardens to help you live a healthier life, to help you live healthy in Miami Gardens. Thank you, and join us again next week at 3 o'clock for another healthcare conversation. Be well.